the number one thing, as a matter of fact, I've even heard clinicians, and maybe appropriately so, I'm probably going to get myself in trouble, as I usually do, but, CAR T cells are therapy, just, the manufacturing is extremely expensive. And they say that's even just for the manufacturing, and a large degree of research and preclinical, and then the logistics of shipping the product back and forth. And so when you look at, particularly in treating acute lymphoblastic leukemia in adults, that proposition can, it's easily going to cost over $500,000 per patient, and sometimes can go higher. And so we were looking at that relative to, based upon ZUMA-3, which had demonstrated a greater than 70% complete response rate that could be durable in a significant proportion of patients, and led to the FDA approval of the product as for the treatment of relapsed and refractory acute lymphoblastic leukemia in adults. We're going, well, this is approved. It's practice-changing therapy in that, and really is the treatment of choice in relapsed refractory patients who unfortunately can't get to an allogeneic stem cell transplantation or relapse afterwards. And so we said, well, what are the costs, and what is that as comparison to patients who don't go through CAR T cell therapy, and what is improvements in terms of years of life and quality life afterwards? And another project which I was very thrilled to participate in, because they brought in experts in economics and in mathematics who were completely kind of removed from the idea of it works at patients. They just wanted to look at the economics. And so we took this data. And again, I, as a clinician, I played a minor role. Because they were trying to say, well, what are the clinical conditions? And these are people who do medical economics all the time. So they could be coming from a completely different background relative to, it just wasn't focused on hematologic malignancies. But at the end of the day, the data was put in, and all of a sudden we came back, and it showed that in terms of value and of what it costs to take care of a relapsed patient, what's their chances of them having life afterwards, there is extreme value in the use of CAR T cells with this product in adults with relapsed refractory acute lymphoblastic leukemia. So I think, I think these types of studies are very, very important when people say, well, this costs so much and this, but again, when you get value back and you look what it costs to just continuously to treat with other available forms of therapy in this patient population. So I looked at that as an important contribution to what in the field of CAR T cell therapy.